Hi, my name is Dr. Marcus Johnson, and I'm an Arrazi Certified Provider. Today we're going to be talking about adhesive capsulitis, also known as frozen shoulder. Now this is a very interesting injury in that it may have a cause from trauma, but more often than not, people come into the office with a frozen shoulder. They literally can't move it beyond a certain range of motion, and there's associated pain. So today we'll talk about the causes, the current medical treatment options that are out there, and then we'll compare and contrast that with Arrazi's treatment model and explain to you why we feel it is a better treatment option. Like we mentioned before, people will come in and their shoulder is literally frozen. They can't move it and it hurts. So we're going to take a closer look anatomically inside the shoulder and explain what's going on. Here's the area in question. This is where the ball and socket of the arm and shoulder blade are going to come together. It's held together by ligaments and tendons of the rotator cuff muscle. Now when there is an injury or immobilization, there will be adhesions and thickening of this capsule with associated inflammation. Here we have a model of the shoulder to further illustrate the point. We'll have the humerus or arm bone, the clavicle or collarbone, and the scapula or shoulder blade. Now the area of concern is right here in blue. That's the capsule. This is the part that becomes thickened and inflamed, where the ligaments are going to be distorted or the fascia within distorted. So what causes frozen shoulder? Well, one can have trauma to the shoulder that's going to disrupt the capsule, causing these adhesions and impingement, but you could also have something like an arm break, to where your arm's going to be immobilized for a period of time. This immobilization is going to cause thickening of that capsule, causing the frozen shoulder. Now, other evidence shows that patients who are diabetic, have thyroidism, or have Parkinson's, that can be a contributing factor as well. Typically, Nsaids will be employed, and these are non-steroidal anti-inflammatory drugs like Advil or ibuprofen. These can be used in conjunction with PT, physical therapy, where you'll do active rehabilitation in an attempt to improve the range of motion, but this can be a protracted course of a few times a week and lasting up to 6 to 9 months. Also, the use of steroids, either with an injection or orally, that's going to be used to control the inflammation. And as a last option, there is surgery in an attempt to remove the adhesions and scar tissue in here. And that has its own set of complicating factors. Let's talk about the Arrazi treatment model and what you can come to expect for your treatment of frozen shoulder. First of all, you'll have a 1 hour long, one-on-one treatment session to where we will assess and treat the injury. We'll start with a highly specific orthopedic examination and palpate the injury to find out the true nature of the injury and give you an accurate diagnosis. From here, we'll employ a highly specific manual therapy that will correct the disrupted soft tissue, putting it back to its original state. We couple this with an active rehabilitation program that will improve your strength and increase your range of motion. This allows us to achieve an average of 3 visits to completely resolve this condition. We hope this video has been useful and informative, and we hope we provided some insight as to why we feel Arrazi's treatment is the best option available for your frozen shoulder. We look forward to seeing you pain-free soon. Thank you for watching.